as Tina mentioned, I am a consultant and a recovering journalist. I started working on verification and what was the kind of, I suppose, the early days of misinformation in Egypt in the Arab Spring in 2011. Over the years, I've worked a lot in training journalists. I worked with Claire back in the early days of First Draft, and it's great to see how that organization has really taken off and is doing really important work in this space. What I thought, and for the last 6 months, I've been working with the Africa Regional Office on infodemic management, I suppose. And it was when we started working on this, it was kind of before infodemiology and infodemic management had a kind of term and definition. And so it's really great that Liz and Tina are running this program. And I think what I wanted to share with you is some of the lessons that we've learned from going about this work with the Africa Regional Office over the past 6 months. Now, I think one of the really valuable points that Claire made so eloquently is the value of partnership and working across sectors and across communities in this space. And that's exactly the approach that we've been taking with the Africa Regional Office to set up a kind of alliance model where the regional office and the XComs and the RISComs team can work with fact checkers and work with national authorities and work with other operational agencies like UNICEF and Africa CDC to share expertise, to make sure that we all know what each other are doing, to help the process of fact checkers getting information that they need to do their work, a really smooth one instead of a really convoluted one. And so I think when I think of the infodemic manager, I think we've been sort of a prototype infodemic manager in Afro. And so I wanted to share today some of the lessons and basically guide you through when a fact checker finds something that they want to work on, what is their process? And my goal here is really to help you understand how you can add value to that process and what you can benefit from in that process and how it works. So we're going to take a kind of quick look at the methodology of fact-checking and apply it to a case that we've worked on recently in the Africa Regional Office. And so fact-checking is basically driven by, fact-checkers are amazing people. They're really diligent journalists and researchers, and they're always asking this question like, how do we know that? Or how does this person who claims to know something, how do they know that? What's their sourcing? And that's a really kind of foundational question of fact-checking. So what I want to look at today, and this is just a little preview of a timeline that I'm going to get into in more depth later, is around the certification of wild polio, of the end of wild polio in Africa, which happened on August the 25th. It's a huge public health landmark. I'm sure that some of the people on the call have worked on this topic, are familiar with this story. What we saw on the 25th was a really, celebratory tone. It was a huge milestone. A few days later, there was an announcement of a CVDPV, that's a circulating vaccine-derived poliovirus in Sudan. And following that, in the days following that, we saw the start of a spread of quite a dangerous kind of misinformation, which is basically saying that UN forced to admit that Bill Gates funded vaccine causes polio outbreak. So in some ways, this is a polio case study, but in some ways it's not, and I'll come back to that later. And so this is one of the kind of earliest examples of this misinformation that we saw, and it's published on this website, 21st Century Wire. It's a US website. It doesn't have a particular Africa focus. It doesn't have a particular health focus, but it contains some really damaging and dangerous claims that between the Africa Regional Office and the fact checkers, we thought this is something that needs to be addressed. Now, the process that fact checkers go through, there are kind of many steps to this process, and I'll come back to this slide again. But what we're going to do is sort of walk through how we took this piece of content and applied this process to it. Now, this is just one example of a website that is publishing this claim. There were also other examples that we found. And so at each stage, we're going to kind of come back to some of the questions that are raised here. And then obviously I'll share these slides with you. I think maybe they're already on the system, but we can come back to this. And then I've got a case that you can try and apply these steps to for yourselves. And so the sort of really crucial initial phase in fact checking is trying to distill what is, if we can simplify, like what is the most simple root of the claim here, and what is why is that important? And so here, if you go through this text, and we'll do it in a minute. The kind of key claim that is really a really dangerous public health message is that the vaccine causes polio. And this is, why is 21st Century Wire publishing this? It's not because they care about Africa or because they care about polio. It's because they want to, in the context of the coronavirus pandemic, they want to undermine confidence in vaccines. That's if you start to try and unpack the motivation here. Is 21st Century Wire interested in the nuance of a discussion around what is the difference between wild polio and circulating vaccine-derived poliovirus? No, they don't care about that. They don't care about polio in Africa. What they're trying to do here is make the case that vaccines cause polio. They're trying to undermine confidence in the UN and WHO, and they're trying to attack Bill Gates. So this is a kind of prime case of the politicization of health misinformation. We see that, as I mentioned, it's not, this thing is not limited to 21st Century Wire. At the time that 21st Century Wire published this, we also saw it cropping up on sites like Global Research Center, which is one site that is often linked to Russian influence operations. We also saw it on sites like Zero Hedge. So there were many sites that picked up and republished this. More recently, and also kind of worryingly, this guy who's hopefully you're not familiar with him and you've been spared him, Alex Jones, a very prominent conspiracy theorist, was hosted on the Joe Rogan Experience, which is I think is the most it's the most popular podcast in the world. I think someone can fact check that for me while I'm talking. But he went on, and if you made it 2 hours into this, he made the case, basically making the same claim that the majority of new polio cases are caused by the Bill Gates vaccine, and the UN vaccine causes polio. So it's a really troubling narrative. And again, Alex Jones is doing that in the context of undermining vaccines as a concept. It's not specifically about polio. He doesn't care about CVD-PVs. So one really important step that fact checkers take, and it's important for a couple of reasons, is to assess the virality and impact of a claim like this. And so it's important for two reasons. One, because fact checkers have far too many things to check, and they're only able to focus on the most important things. So, a group like Africa Check, for example, or Pacer Check, they may have, I don't know, hundreds of things to check every day. They really have to focus their attentions, and assessing the virality is one way of doing it. It's also important in another sense, which is if a claim like this has only been seen by 2 or 3 people, and Africa Check pick up that story, do a debunk, and publish it with all their media partners in South Africa, there's going to be this undesired effect of actually amplifying the false claim. And we want to be really careful about doing that. And when we're assessing virality, it's also important to flag, and this is a good case, that in this case, we didn't initially pick up this story as WHO Afro or with the African fact checkers, because the first 2 examples here where you can see really big Facebook interaction numbers, all of that was happening in the US and Europe. It wasn't happening in Africa. And so we didn't want the African fact checkers and ultimately African media to pick up this story. It wasn't a priority at the time. What we saw, interestingly, was a translation of this article into French, which then we did start to see getting traction even at lower numbers in Africa. And so you have to think about virality not as a kind of global concept, although it can be, it can be useful if you see something that's really, going, truly viral globally. Virality can be at a community level. You could have something with only hundreds of Facebook interactions, for example, but in a small town or in a city, that can represent a really dangerous kind of local virality. So it's really important to think about virality happening at the local level as well as at a national or a global level. Just to quickly show you the tool that we used to do this is a tool called Crowdtango. It's a free tool that is owned by Facebook. Oh, hold on, can you show? I'm gonna just here we go. It's a tool that's owned by Facebook. It basically lets you build lists of Facebook pages and Facebook groups. So this is an example of a COVID misinfo group that we've got. And we can see that here, this has been something that's overperforming, as in it's getting quite a lot of traction. And it's an anti-WHO piece from news.com in Australia saying that there's a backflip on virus stance. Now we could go into the details of fact checking that. I'm not going to now, but there's a couple of useful features of Crowdtango. One is that we can build these lists and we can assess the virality of different links and videos and images and claims. It also has a really powerful search functionality, which lets us look specifically at regions. So these are all of the countries in Africa that we've limited our search to. And we can sort by, we can filter by date, we can filter by language, we can look specifically at different types of posts, for example, and we can sort those by the most interactions. We can also look somewhere here, we can look at different types of, different types of content. We can look at different platforms here. But so this is just a quick search for the last 30 days. What is the most engaged with content on Facebook in all of these countries about vaccines? Great to see that UNICEF is out there in front, but we don't have to scroll very far to start to see things like this, which are better dead than vaccine. And then if you scroll a bit further down, you can see this cropping up again and again and again and again. So this is a really useful tool in identifying sources of misinformation, also for identifying claims as we go. Just another quick tool that we use in Afro is called Spike. Spike has a number of dashboards. This is a recent one that they've created called the Crisis Dashboard. Again, this is a search for vaccines, and it shows us public interest in vaccines over the last month. We could start to investigate what is happening to drive some of these spikes. Again, you can filter this by region and by different kinds of platforms. So these are some of the tools that we use to, and the fact checkers use also to assess virality, which is this really important initial step in fact checking, like deciding what do we want to investigate. So this is the next step is to confirm, is something fact checkable? And so there's kind of three sort of types of statements that we can look at. Ones that can't be fact checked, sort of statements that somewhere in between, and statements that can be fact checked. And so if we look here There are a lot of claims here, and they're wide ranging. And again, one signal that this is not a serious piece of journalism is how the claims here jump around a lot. They bring in all kinds of different, there's a lot going on here. And so if we apply this kind of can't be fact checked, can be fact checked, and in between to this, we can see different things. So it's not, we can't really fact check this statement. This really should be one of the biggest public health scandals of the decade, but instead it's given little attention, mainly because of the high profile nature of the people and organizations involved. That's not something that is that we can research, that we can say this is true or this is false. That is speculation from a hostile source, and that sort of sets the tone for the rest of this article. Now, there are things that we can investigate here. Has the United Nations been forced to admit that a vaccine initiative is actually causing a deadly outbreak of the disease? Are vaccines causing the deaths of scores of young people living in Africa? Has the government of Ethiopia ordered the destruction of all this oral polio vaccine following a similar outbreak of vaccine-induced polio? So here what we're trying to do is filter what we can look at from what we can't. And it's really important that we don't get sort of bogged down in the things that we can't, because a lot of the time that's trying to politicize a lot of what is going on. So again, once we've kind of gone through that process, we then want to isolate the key claims. In this case, the claim is, does the polio vaccine cause polio? At this point, fact checkers, they're really careful people, and rightly so. They like to build a lot of transparency into their work, and so an important point of the process here is to think about any barriers or biases that we might have. So we can't, for example, if we've heard about something like this before, it's important that rather than just using the stuff we thought we found about this case that might be related before, actually we should go back and check the sources. We can't just use the memory of something that's similar to fact check something. It's important that we, you go through the process and you investigate and you find the right sources. And it's important that we are kind of aware of some of the biases that can risk not just fact checking. This is kind of any journalism, really. And so I'm sure that these have come up elsewhere on this course. Confirmation bias, which is do we have, and this is from the fact checker's perspective, do they have some belief or a kind of worldview through which they're going to try and interpret new information? It's also, useful to think about these things from the audience's perspective. Is there any kind of end goal? Are we trying to, is there a risk that we could fall into this kind of motivated reasoning trap, whereby we are finding information to fit that end goal, which may not be our worldview, but it might be some goal that we have. And this is a really important one, I think. Some information is easy to find, some information is hard to find. If we only use the information that's easy to find, then we are not providing the full context. So these are some of the things that fact checkers are considering when they're going through their investigation, which I think we also, as kind of infodemic managers, should also be considering. And then we get to the kind of the phase of finding the facts. How do we actually address some of these claims? And so in this phase, it's really important. There's a lot of questions that we can ask about sources. And I think the reason I wanted to show this to you is one of the goals of the Response Alliance that we've been working on in Africa is there's a lot of expertise that the WHO and Africa CDC and UNICEF have at a technical level about things like circulating vaccine-derived polioviruses. You know, people have been working for 20 years on polio vaccination campaigns who are well across the data. They're well across how the technical specifics of how vaccines work and why they work and where they work. And so, but it's not always easy for fact checkers or journalists to be able to access those people and ask them the questions that they need. And so infodemic managers, I think, sort of sit in between technical experts on subjects like polio or coronavirus or vaccinations and public-facing fact checkers and journalists who need to access that information. And it's not always easy to bridge that gap. And so I want to show you here some of the questions that fact checkers would have as they maybe would come to you to ask these questions, so that you can kind of in advance prepare how you're thinking about some of the questions. So proximity, like, can you present the most relevant evidence to the claim? So what is the key evidence that we need to find around whether vaccines cause polio? How do we communicate effectively the credentials and expertise that we have for our own evidence, if we're the people giving technical input on a claim like vaccines cause polio? Can we show to the fact checkers and ultimately to the public how we've collected that evidence? What is the scientific method or process that we've used to gather that evidence? And how can we be transparent about it? What do we know? What don't we know? These are really important considerations. Is there a record over time that we can point to for the fact checker to evaluate? So again, these are questions that fact checkers would have when they might come to a Ministry of Health or WHO or UNICEF. And so by looking at these, hopefully we can be better prepared for a productive kind of engagement with the fact checker. Because ultimately, you know, in this case, the fact checker's goals are to get to the truth about this question of, do vaccines cause polio? And our goal is to provide, you know, we have a lot of scientific evidence about that. And so we need to communicate that effectively. And then finally, and in this case, and a lot of cases actually, but especially in this case, is the question of context. One of the most common things that we see with kind of misinformation actors, and we saw it so much over the past 2 days in the elections in the US, is a claim like vaccine-derived polio, vaccine causes polio, is stripped of a lot of really important context. Now, in that process of stripping out the context, the claim itself becomes weaponized, and it becomes kind of, in some ways, that's where it loses all of its validity. So in the past couple of days, we've seen claims that Democrats are trying to steal the election based on a video that might show a voting machine that's not working for 2 hours or something. Now, that machine really wasn't working for 2 hours. That's fine. That's a true claim. The context is that gets manipulated and added is, this means the Democrats are trying to steal the election. And so it's, in some ways, fact checking is kind of all about context. And we'll come back to some of how that, in this process, we tried to add back in that context. So a couple of sources here that are useful, and again, that fact checkers would be looking for, and which we should be prepared to either to point to, or in some cases, we are these sources. The WHO, you know, has obviously done a lot of work on polio, the Global Eradication Initiative. In this case, there's actually a very nice video that explains what is circulating vaccine-derived polio, and how does the vaccine, how does the oral polio vaccine work? This is a really, really useful explainer a video, because it takes what is actually quite a nuanced topic and distills it down into something that's really accessible. So I think this is actually a really good example of information about this. It's not it's more kind of public facing than fact checker facing, but I think do check this out, because it contains a lot of well sourced information that is easy to follow, but it's quite a nuanced topic. So one of the challenges that we had in this story, and which you will also encounter, is the role of mainstream, rigorous journalism in the misinformation ecosystem. So before 21st Century Wire published their story, the AP actually published a story about the outbreak in Sudan. And it had this headline: UN says new polio outbreak in Sudan caused by oral vaccine. Now that is not true. It's missing a lot of context. Now, the reason that the AP can publish this, however, is through linking to a very technical statement that the WHO put out on the 1st of September. Now, I think there's two lessons here, and I think the infodemic manager role is really hard, because you're stuck right in the middle of somebody who has to write a headline about a very complex topic, and a requirement for the WHO to publish a full technical report on what they're observing in a certain community. Now, the challenge here is that the WHO report is so technical that it buries the kind of key information about what is the key, very simple message about circulating vaccine-derived poliovirus, which is that vaccine-derived poliovirus is a consequence of under-vaccination. This is the really key message about vaccine-derived poliovirus. It occurs in communities that have not been adequately vaccinated. And one of the reasons that we're seeing new outbreaks is that a lot of vaccination programs had to be paused due to COVID. So that is a very simple message. And what I would have advised the drafting of the statement would be to lead with that, or put it very high. You can see on the side, actually, the information here is a bit buried, but if you click the about poliomyelitis, Helene is going to shout at me for not pronouncing that correctly. That's where the information is, but it's buried. So from an infodemic manager's perspective, you need to be able to make sure that the key information, you need to anticipate that there could be a headline written like this, and you need to make sure that any journalist who quickly scans this is able to find that actually the claim that polio is caused by vaccines is false. It occurs in communities that are under-vaccinated. And actually in the story, of course, the AP flags that these are very rare, and that it's caused in it happens in under-vaccinated communities. But the headline is really damaging. That's what Alex Jones referenced. That's what features in the 21st Century Newswire piece, and is really challenging. Another sort of risk I wanted to flag, or something that we see happening, is that your work can be weaponized, or WHO comms work can be weaponized. Ministry of Health comms work can be weaponized. So in this case, in the 21st Century Wire piece, there's this claim, in 2019, the government of Ethiopia ordered the destruction of 57,000 vials of type 2 polio vaccine following a similar outbreak of vaccine-induced polio. The WHO did publish a statement saying this. The context is that's what you're supposed to do. It's not a sign that the vaccine caused the outbreak. It's just what you're supposed to do with MOPV2 vials after they're, you can't, instead of storing them, for example. So it's, again, this is kind of the missing context here, is that this is standard procedure. It's not a sign that the vaccines were, the vials were destroyed because they were dangerous. And so then we get to this, a really fundamental part of fact checking, which is how do we correct the record? If I'm going over time, just somebody give me a shout. How do we correct the record? And this is a really important thing to think about, because there's ways that we can do it well, and there's ways that we can do it badly that can create new risks, basically. So in this case, our role was we worked with the fact checkers who came to us. They had questions about some of the stuff that they were seeing. They wanted to understand the full. They wanted to understand the full context. They wanted to speak to sources that were authoritative, and so they came to us, and moving forward, you will be responsible for making sure the fact checkers have the info that they need. The goal here is to add in the context, and also to emphasize that this is something that is misleading and false. And so you can see that the AFP here, they do it. There's a long article, but they're hitting kind of three main points. One is that it affects populations with low immunity, and the vaccine-derived polio is genetically different from the virus found in vaccines. The second is that the polio can be prevented through vaccines. And the third is the kind of more full statement from Oliver in this case, where he's saying that these happen in areas where there are immunity gaps, and it's a factor of low vaccination coverage. So in this story, AFP linked to the WHO's statement on this, which is the kind of explainer of what is vaccine-derived polio. And this is the kind of really key additional context. Since 2000, more than 10 billion doses of oral polio vaccine have been administered to nearly 3 billion children worldwide. As a result, more than 30 million cases of polio have been prevented, and the disease has been reduced by more than 99%. During that time, 24 CVDPV outbreaks have occurred in 21 countries, resulting in fewer than 760 cases. So this is the kind of the key context that is missing from the 21st Century Wire article and from Alex Jones's quick spot on Joe Rogan, that there have been 10 billion doses of this vaccine administered. The disease has been reduced by 99%, and there have been fewer than 760 cases. That number may have changed now because we've seen outbreaks recently. One sort of good structure that fact checkers often use for addressing this, and that we try, people like Claire and I bang on to journalists all the time about how they frame false claims. And this is one of the structures that can be used, is to never lead with the false claim, but to lead with the truth, put the falsehood in the middle, and then follow up with the truth. So it's called a truth sandwich. It's a concept that comes from George Lakoff, and it's the goal is here to kind of benefit from psychological drivers of kind of primacy and recency. So the things that we see first and last in our minds, we hold on to them in a stronger way, and so we can use that as fact checkers to make sure that we are not leaving the audience with the false claim as the kind of most prominent thing. Now, there's ways not to do this. This is an example that I think is pretty bad, where you have a false claim, which is Bill Gates bribed Nigeria to test vaccines on children. You frame it as a question: did Bill Gates bribe Nigeria to test vaccines on children? And the answer is no, of course not. So this is something to really avoid in fact checking. And again, we spend a lot of time trying to help fact checkers think about some of these issues. Question framing really lends an undue credibility to the false claim. What we did with WHO Afro and with the fact checkers is to try and work on some content that we hoped could address some of the claims here. I don't think I can share the audio, can I? Maybe not, but again, I'll share this with you, but I just want to give you a quick sense of what this looks like when we work on it. So the goal here, you'll notice that it's in a square video format. A lot of the people that we would want to see this content are going to view it on their mobile phone. So we think it's really important that it's in a format that they can access. We translated this into French and into Portuguese. And in this video, we really try and clarify what is the oral polio vaccine. We hit on this really key message, which is that cases have declined by 99.9% since 1988, thanks to the oral polio vaccine. What is vaccine-derived poliovirus? When does it occur? How does it what is the risk, which again is under immunization population over time? And what is the solution to vaccine-derived polios, which is vaccines? And so here we're trying to take what is quite a complex, nuanced topic, distill it into content that is somewhat engaging and shareable and clarifying. This is what the kind of full timeline for this case looked like. So the kind of key dates here, the 25th, we had this certification announcement. In this case, and this is again somewhere that you can add value to the kind of fact checker community and journalistic community, and why it's good to work together. We knew that the certification announcement was coming, and we knew that a big announcement about wild polio could result in misinformation about vaccine-derived polio. And so in this case, before the certification event, we actually hosted a pre-certification briefing with fact-checking groups in Africa, where we got technical experts from the regional office to answer questions and basically explain any of the concepts or historic misinformation that we've seen around polio to the fact checkers, so that they had really, before the event, we were kind of ready for something that might come. And I think that fact checkers can't do that by themselves. Journalists can't do that by themselves. And so when we work, together with civil society, groups like WHO, UNICEF, and fact checkers, we can start to be a bit more strategic with how we're thinking about these kind of things. So we had this briefing where we said we expect there's going to be misinformation around vaccine-derived polio. The certification event happened. There was an outbreak in Sudan. The AP published their story. That got picked up by 21st Century Wire and 100 other people. Didn't really go viral in Africa until a bit later. And so it was later that AFP and Le Monde published a fact check in French that also went out on the AFP wire, which is great because that has a much bigger audience. And then following that, we worked on the video that we just showed you. I think probably it's best to take questions now. At the end of my slides, which I will share, I've got an example here of some claims around 5G. And so you can kind of go through and apply this process to the 5G, the 5G claims, which obviously I think a lot of you are familiar with. And you can kind of go through, see if you can isolate the checkable content, find the facts, and maybe you could think about what a debunk would look like. So I'm happy to take any questions from Slido. And yeah, would also love to hear about people's experience of working with fact checkers.